case scenario. We'll get into the worst case scenario in a moment, but first, give our listeners some optimism. What is the best case scenario here?
Sure. Well, it's funny. This paper was released almost 2 weeks ago, and it's just extraordinary how much has changed since then when I was reviewing these notes this morning. I would love to be optimistic. The best case scenario, basically, we're helped out by Mother Nature. So in the best case scenario, immunity lasts a very long time, right? So if somebody becomes infected and recovers from COVID-19, they become immune to reinfection, and that immunity lasts for something like, 1 to 2 and even more years. And so that means that once folks do recover, they can re-enter society safely and they won't pose a risk to themselves and without posing a risk to others. So that's a major factor that could facilitate a more rapid recovery from the epidemic. And really, in the best case scenario, the virus would mutate and basically fizzle out. And that has happened before with SARS and some degree with MERS. So that is a possibility, but it would, obviously help us out the most. The best case scenario also involves, a more robust response from the federal government. So we've talked a little bit about imposing a national lockdown, rapidly expanding testing, contact tracing, and isolation capacity across the United States. We're still facing testing bottlenecks today, but if that were addressed and if we're able to sort of levy a contact tracing army, that would make a massive difference. And procurement of critical medical supplies to protect our frontline workers, our healthcare workers, if that's scaled nationally and done more effectively and PPE has gotten to those places that are most in need, then we can protect our healthcare workers, we can protect our hospitals and prevent them from being overwhelmed. So that's a quick summary of the best case scenario, and it would conclude, importantly, with a vaccine. And the earliest that would likely happen would be sometime in 2021, likely the fall of 2021. So in this best case scenario, that vaccine would be developed and it would be rapidly and equitably distributed.
And now for the brutal truth. What's the worst case scenario?
So the worst case scenario, if we're to focus on, the aspects of the virus first, in a worst case scenario, immunity would not last a long time, which would mean that folks could potentially be reinfected with the virus during the subsequent waves. It would mean that the virus does not go away, but in fact persists and continues to return. We haven't talked much about seasonality, but there is some hope that the virus will get a bit of a reprieve during warmer months from the virus, and that it won't be transmitted as easily in warmer weather. In the worst case scenario, this wouldn't be the case, and it would just continue and persist year round so that we wouldn't get a break to sort of rebuild our systems and our stockpiles. In the worst case scenario, we fail to protect our healthcare workers. There's chronic shortages of PPE, which are now the global supply chain for PPE is severely strained right now. And so when our healthcare workers aren't protected, hospitals are more easily overwhelmed. And this has implications not just for COVID-19 patients, but for all patients, for cancer patients, for people who are having heart attacks, any sort of hospitalization you can imagine. And so we'd see an increase in deaths across the board. And in this scenario, we don't get a vaccine. That is a possibility that we would fail to develop a vaccine, which is the only thing that can definitively end the pandemic. And so, as the public health crisis intensifies and worsens, the corresponding economic crisis, of course, only intensifies. And ultimately, this leads to civil unrest and violence, requiring a large-scale deployment of the U.S. military in order to maintain order. So that's our darkest potential scenario.
That's pretty scary.
It is. And for the record, I don't think that we're headed in that direction. But, the purpose of the article that we posted in early April was to just present scenarios at different points of the sort of full spectrum. And so we felt like it was important to ground these projections and, what the absolute worst case could be. But we're seeing now, as I've said earlier, that social distancing is working. And we're seeing that we're scaling up testing. And people are recovering, and we're reaching an apex and perhaps starting to flatten the curve in New York. So there has been progress. And so, we have to maintain focus, because if we ease up too quickly, there's a real risk of regression. But I think that from what we've seen in the last month, and even just the last 2 weeks since we wrote this article, I think we're on a good path to somewhere, I think, in between scenario 1 and scenario 2.
So right now, it seems like the most likely outcome for this pandemic, as you just said, is what you're calling a roller coaster scenario, which is characterized by that patchwork of responses and continual resurgence of cases. Why does this seem like the most probable course of events to you?
This is the most probable outcome in my mind because the United States missed the boat in February. The U.S. response was delayed. And because we weren't able to prepare our hospitals and our healthcare workers and our healthcare system with the supplies and the commodities that they needed, did see some systems become overwhelmed, and we saw unnecessary deaths, as we're seeing in New York. And once you reach that point where you have overwhelmed healthcare systems, it's very difficult to turn back the clock. So I think, the other reality that we're seeing is even in countries where they were able to act really rapidly and really aggressively at the onset of the outbreak. So for example, in Singapore, as you start to ease restrictions in order to allow people to go back to work and to re-enter society, gradually and safely, you do see resurgences. And so I think the nature of this virus is such that it requires sort of intermittent tightening and releasing of those restrictions in order to, again, keep people safe and protect the vulnerable, but also start to unfreeze the economy. And I think that that's just going to be the course of action that's required until there's a vaccine. And so that's what we talk about in that sort of roller coaster scenario. We've got a late start. We see, a number of sort of hotspots and outbreaks early on. And then as time goes on, we get a lid on it. We maybe get a little reprieve over the summer. We're able to stockpile our hospitals and better equip our healthcare workers, and then slowly, release restrictions and then tighten them again as necessary, and based on the outbreaks in different locations across the U.S.
So you had just discussed how it's likely we're actually going to have multiple outbreaks. And just as you've said, we're now seeing that in countries like China that had initially done a very tight lockdown and is already having a resurgence. It's possible, if not likely, both the economy and our lives are going to have to basically be shut down again and then start again and then shut down again and then start again. Is that what success looks like? Or is there something more that we should be striving towards until there's a vaccine?
I would say there are two things. Well, there are a lot of things that the U.S. needs to focus on. There are a few other things that I think could facilitate the tightening and easing and maybe help us sort of speed past that phase. One would be effective therapeutics. So any therapeutic that significantly improves outcomes of folks who do contract the virus would make it less risky to open things up, even if the virus continues to circulate at low levels. So that would be sort of a technological innovation and milestone that could be really significant. I think the other is more sort of systematic, and that's a really robust testing, contact tracing, and isolation system. So, we've seen this in South Korea, in Singapore, and in Wuhan, in China, privacy issues notwithstanding. In each of those places, they had enormous teams of healthcare workers tracking individual chains of transmission. And so when you're able to track the virus from person to person to person at that individual level, you don't have to put a sort of blanket social distancing requirement across an entire community or neighborhood or county. So I think the more and more rapidly we're able to build up a really strong testing, contact tracing, and isolation system, the less we'll have to rely on those sort of blanket social distancing restrictions.
Obviously, we want to have massive tracing, massive testing, knowing what's going on. On the other hand, a number of plans have started to become released by different think tanks and nonprofits. And some of them have very serious privacy implications. And the question then becomes, what elements of our rights and the things that we took for granted before the crisis happened are we willing to sacrifice? And again, is it appropriate for experts to be making the decisions about what our rights trade-offs are going to be, and to what extent does the public get to decide what they want to do in their society? And is it okay for countries to have different responses in terms of privacy?
Well, I'm so glad you asked that question, because we're about to release a paper on this very issue this week. And so there's more to read about on this. But I believe that Americans are going to have to come to grips with a greater degree of monitoring of individual health status than we have ever seen before in this country. If we look at the models that were implemented in countries like Singapore, China, Taiwan, and South Korea, when it came to contact tracing, most of them involve mobile phone applications that invaded personal privacy in a way that most Americans would not accept. However, as you point out, a number of plans or proposals have been released in the United States that provide a roadmap for contact tracing that would involve both manual human contact tracing and some degree of digital contact tracing in a way that would protect American privacy. However, I think Americans will still need to be convinced by their government leaders, I think it'll be a multi-sectoral effort. I think it'll be government leaders and faith-based leaders and teachers and educational leaders and academia coming together to sort of convince Americans that they might have to submit, their health data and and comply with, really widespread contact tracing efforts in order to ensure their own health and safety, and also to ensure their economic security. I think that degree of tracking and things like temperature checks outside of restaurants and workplaces, those things are going to be required in the interim to open the society back up and start unfreeze the economy. So I think it's going to be a challenge in the United States. I think it's going to be a unique process everywhere. And it's certainly true that we can't and we won't and we don't want to replicate sort of invasive systems that are used in China, for example, where they effectively have a surveillance state. But I think that there's going to be more monitoring of health, individual health, than most Americans have ever experienced before.
As we wrap up this interview, we want to ask you, what did we miss? What information does our audience need to know right now to help us get to that, if not best case scenario, then a better outcome?
So I think what I would say, particularly because this is a university podcast, is for young people to understand that even if they are less vulnerable to COVID-19, they can still transmit COVID-19. I think that the response to this epidemic in the United States, and in order for us to bring an end to this epidemic in the U.S., will require a communal approach that to some degree runs counter to the very sort of individualistic society we have in the United States. And I think that young people are going to play a really important role in protecting more vulnerable populations moving forward. So I think that's what I would urge listeners to keep in mind as we sort of face the next few months together.
Ms. Carroll, thank you so much for speaking with us today.
My pleasure. Thanks so much for having me.
And that's a wrap on another episode of UC3P. Credits go to Caroline Kubzansky for co-producing, co-interviewing, and editing, Sidhant Wadhera for co-producing, and me, David Raban, for co-interviewing. Our assistant production managers are Arjun Mota, Olu Ogidan, Saumya Kadun, and Sidhant Wadhera. Our finance director is Donovan Harvey. Our publisher is Yaning Wang. Our intro music is Knockout 2 by The 2B, and our outro music is Yes Yes Y'all by Matt Large. Our cover art was designed by Shirin Raban. If you want to hear more podcasts, check out our website, uc3p.org. And if you want to contact us, our email is the uc3p@gmail.com. And if you haven't already, please remember to subscribe on your favorite podcast platform and share the show with a friend. We really appreciate it, as it helps us reach more listeners like you. My name is David Raban, and stay tuned. We'll be back next week on what will happen next with our economy, as we speak with former governor of the Bank of India, Raghuram Rajan.